My name is John Munthali from MSH Malawi office. I'll be discussing malaria in pregnancy and NCDs, opportunities and challenges in Malawi. We have seen over time that in Malawi there is limited commitment towards NCDs, both at the national level and at partner level. We haven't seen high visibility or a lot of resources being put into NCDs. But at the same time, we have seen that the Ministry of Health has given a high priority to malaria in pregnancy using the FUNK platform. At the same time, the government is moving forward in trying to pilot MIP at the community level. What's the FUNK platform is a very good platform. We don't see a comprehensive NCD screening process taking place during antenatal service delivery, but at the same time, we have seen that the Ministry of Health in its policy supports the screening of malaria. However, we haven't seen resources being put into test kits for anemia. As such, not all women that are going through the NC are being tested for anemia. But at the same time, we are cognizant of the fact that malaria does induce anemia in pregnant women, which results in significant harm both to the mother and the baby. We also have to be aware that nutrition-induced anemia is a big problem amongst pregnant women, and more especially in Africa and Malawi as a country. We are having this as a big problem. In all this, there's still an opportunity that we can bring NCDs on the FUNK platform. As we know that malaria in pregnancy is supported through the delivery of ITNs, provision of SP as an IPTP to women that are coming to antenatal, and prompt case management. So there's an opportunity that we can encourage, we can work with the Ministry of Health to begin testing for anemia at antenatal clinics. Since we know that IPTP or SP that is given to women helps to reduce the problem of anemia that can be induced by malaria. So testing of anemia would complement and help to see whether the SP is indeed working in women. But there's an opportunity as well that we can, during ANC, create an opportunity for screening of NCDs. Could be anemia, as I've already stated, and other NCDs, which would make the mother more susceptible to malaria infection. There's already close collaboration that exists between the National Malaria Control Program and the Reproductive Health Directorate in Malawi, which provides an opportunity for the NCD unit, which is already available in the Ministry of Health, to join hands, work in close collaboration with these two units, and use the existing FUNK platform in order to deliver services for NCDs. But also we are aware that services here in Malawi are highly provided on an integrated platform, or one of which, as I've said, is the FUNK platform. And MIP services are built on that integrated platform, where a number of essential health package of services are provided at all levels, be it at the community level and be it at a facility level. Now, equally, the maternal health component is built on a continuum of care from the household up to the facility level. At the household level, at the community level, we have a well-functioning community-based maternal and child health service, where also issues of anemia can be easily tackled by community health workers. And that goes up to the facility level, where we have the already existing FUNK platform, which is a well-established platform that is providing incredible services and that has a well-functioning system, including well-trained nurses and clinicians who would be in a position to provide services to women as well as NCD services to women that would come to antenatal clinics. The use of screening for anemia can be used to leverage high-level support to prevent malaria in pregnancy. So we can also think of beginning to screen for other conditions, including NCDs. Could be hypertension, could be diabetes. So there's an opportunity here on the already existing integrated platform that is there within the Ministry of Health. But also, as I've already said, that promoting integration of the essential health package would also provide an opportunity for the FANG platform or the ANC services to screen for NCDs, which are a growing problem in the country. Diabetes is a growing problem, anemia is a big problem, and all other NCDs are becoming a big problem amongst the pregnant women who are already vulnerable to these conditions. But then how does the Malaria Pregnancy Platform works, and how can we use it to bring in NCD services? As I said earlier on, the National Malaria Control Program works in close collaboration with the Reproductive Health Directorate, who are the custodians of the FANG platform. So when there's a new direction from WHO, or when there's a new recommendation from WHO, I would give an example of the 2012 guidance on IPTP, that countries can move from 2 doses to as many doses as possible of SP. Then the National Malaria Control Program and the Reproductive Health Directorate worked in close collaboration. They developed the MIP policy and they developed the guidelines that led to the development of training manuals that have to be used to build capacity amongst health workers. Subsequently, they trained trainers of trainers who had to cascade the trainings to facility level and to even community health workers, just to make sure that the service is provided according to standards. They factored in performance and quality improvement processes, supervisions, mentoring, and coaching. And at a community level, they made sure that SBCC messages are there, communities are mobilized, communities are sensitized, and they are aware of the change. So equally the same, the NCDs or the NCD unit can use the same platform, come together with the Reproductive Directorate, the National Malaria Control Program, or other stakeholders that may be interested in NCDs, develop the policy, guidelines, manuals, or job aids, do the trainings, orient health workers, and use the already existing platform to deliver the NCD services which are in need. Women we know are in need of those services, instead of maybe having totally vertical service somewhere, but just bring it on the FANG platform. Now, let's look at maybe what we can call the evidence-informed platform for action. As I said, in 2012 up to 2013-14, the MIP policies, the malaria and pregnancy policies, were adopted, implemented, and they're even now going to be implemented at the community level. So at the facility level, using the existing FANG platform, when there was a change issued by WHO, 2 units worked together. Within a year or 2, they developed guidelines, training manuals, and they implement it. And now the government has seen the need that IPTP can even be delivered at the community level. And the government has given a go-ahead. The IRB for the feasibility study has been given to MSH so that they can pilot delivery of IPTP at a community level. This is as a result of a collaboration between 2 units, reproductive health and NMCP, trying to offer services at an integrated platform. The same can be used for NCDs. We can start at the FANG platform, see how it works. We never know. The government might be even so keen that these services can even go to a community level. There are already structures that are there from the community level to facility level, and that would be maybe the way to go. As a result of this collaboration, use of the integrated platform to build on other services, over the years we have seen that antenatal attendance has increased amongst the women that are completing 4 visits from 19% to 24%. This is just the recent malaria indicator survey. Equally, we have seen that IPTP3, which was just introduced a few years ago, It was 13% in 2014, 30% thereabouts in 2015, but in 2017, it's 14%. The National Malaria Control Program haven't used any other panel structure. They are simply building on the FUNC platform, which is well established and is able to deliver. But what it took for them is to come up with manuals, orient the staff, build capacity among the staff, the already existing staff, then the service is being delivered. As the way forward, we should be aware that malaria could be an indication of another underlying problem in pregnant women, and this could be an NCD. We need to coordinate and collaborate with, let's say, the NCD unit and other units within the Ministry of Health and integrate among partners in trying to build capacity for health workers, update policies, and maybe update guidelines so that NCDs are also incorporated in this platform. It will be important that this high-level support emanates from the government and other partners, could be USAID, PMI, or other interested partners in the areas of NCDs. And that also includes funding, and that is so important. So if we build a collaboration between these partners, we can move forward and work on integrating NCDs on this FUNC platform, which will be so important. And maybe we can start slowly by screening, emphasizing or strengthening the screening of anemia, and that maybe can be linked to multiple illnesses, including NCDs. Thank you.